At Western's Bone and Joint Institute, leading-edge research in musculoskeletal health is being conducted by researchers and clinicians in collaboration with key external stakeholders, such as community, industry, and government partners. The Institute aims to better understand bone and joint diseases and encourage the development of novel and creative innovations from cellular levels to patient-centered therapies, diagnostic and evaluation tools, medical devices, and innovative healthcare strategies.
Musculoskeletal or MSK conditions such as arthritis, osteoporosis, back pain, skeletal fractures, and sport and workplace injuries affect over 1.7 billion people worldwide. MSK conditions are the most common medical causes of long-term absence from the workplace, and the second most common reason for consulting a physician. The burden of these conditions has increased 45% over the last 20 years, with a substantial impact on people, healthcare, and social systems around the world. In Canada, it's estimated that MSK conditions cost at least $33 billion annually, and that the number of people affected will double to 15 million by 2031. In 2015, Western University in London, Ontario established the Bone and Joint Institute with a vision of lifelong mobility and 4 primary objectives: to understand bone and joint diseases, innovate in diagnosis and evaluation, develop and evaluate new therapies, and influence key knowledge users.
The Institute is guided by 4 core values: collaboration, excellence in innovation, education and research training, as well as knowledge translation. We have collaborative teams of faculty and trainees across multiple disciplines that work closely with external partners to develop and test ideas. We call it molecule to community and back again.
By bringing together cell and molecular biologists, engineers, imaging, social, and clinician scientists, as well as community researchers and industry partners, we can examine gaps and solutions from multiple perspectives and capitalize on our unique strength to innovate. Our collaborative transdisciplinary team approach inspires discoveries and the creation of novel, patient-centered therapies, diagnostics and evaluation tools, as well as medical and assistive devices for widespread bone and joint diseases.
The Bone and Joint Institute is committed to producing the next generation of musculoskeletal research leaders through the collaborative training program in musculoskeletal health research. This program provides undergraduate summer students, graduate students, postdoctoral fellows, and clinician scientists in training with an innovative, integrated curriculum that is focused on core concepts of biomedical, engineering, clinical, and health services research. Our program includes courses, learning modules, workshops, seminar series, and retreats across faculties and institutions. Trainees that join the program are eligible for training awards and stipend enhancements. They're also more successful in competing for external scholarships.
A major focus at the Bone and Joint Institute is to take new knowledge and translate it into real-world application in the community, marketplace, and healthcare clinics. One of the unique aspects of the Bone and Joint Institute is that we develop and transfer intellectual property to our private sector partners with the goal of helping industries thrive.
The knowledge produced at the Bone and Joint Institute will help to improve the lives of people at risk for or suffering from musculoskeletal conditions. You can join us in the pursuit of our vision by studying and carrying out research as part of the collaborative musculoskeletal health research program, partnering with our world-class researchers as an industry, government, or community partner, or by making financial contributions towards our trainee program or awards, research catalyst grants, infrastructure or equipment, and faculty recruitment and startup funds. The Bone and Joint Institute is excited about where we are and even more excited about where we're going.